we were talking about at public hospitals that healthcare is offered for everyone. So I was looking into this. The World Health Organization, they introduced this, I think in 2013, 2014, universal health coverage.
Yes.
They wanted all countries to have a staple to deliver health services for everyone: preventative, treatment, rehab, palliative care. Pakistan introduced in 2015 the health card, or the
That was under Imran Khan.
was it Imran Khan? So I read it.
It was Imran Khan.
So Imran Khan, did he introduce it nationally? But it was trialed in KPK.
So KPK was Imran Khan's government.
Okay.
So
okay.
2015 Imran Khan was it was KPK was under Imran Khan.
Okay.
So it was introduced only in KPK.
Oh,
and when
that's
he
why.
became
Okay,
the
yeah.
Prime Minister of Pakistan,
Yeah.
then he introduced it all around nationwide.
Okay.
And actually it was for the poor people.
Yes.
And there was quite a ransom amount that
Okay.
you can get in that, and actually your all health services would be covered in that, and people were really happy about it. So I think that was a great move, and I'm not sure whether the new government is following that,
Yeah.
but I think he made a lot of changes in the healthcare system that were really good. Few of them we could see the difference at that time. Unfortunately, most of the things we were not able to see the difference because of the government change and the system change, and obviously they were not implemented then.
So it was introducing. Okay, that makes sense now.
Yes, it was introduced in KPK under Imran Khan
Okay,
in
because
2015.
Nawaz Sharif was the prime minister at the time.
Yes.
But yes, KPK, yes.
KPK
was
was under
Khan's
Imran Khan.
parties. Yeah. Right, okay. And then he saw this initiative and
Yes.
thought, I'll introduce it here.
Yes.
And then when he became prime minister,
Yes.
okay.
Because I know all these things because I was the primary fundraiser for Shaukat Khanum since my school.
All right.
So I have been quite involved in the fundraising for Shaukat Khanum.
All right. So before, let's say, 2015, what was not offered to every Pakistani? What was it actually? You can receive anything, or was there gaps in what could be offered in your healthcare system?
So the government setup was free.
So government was free. Okay.
Government setup is free.
Yeah.
Government setup is free for everyone.
Okay.
But obviously then it comes with a lot of compromises, quality compromises. The availability of beds. The people are even in the corridors because there's so much crowded.
Mm.
And then you have to admit that obviously the staff the hospital would be having is not equal to the number of patients or the crowded hospitals we have. So I think government setup in terms of doctors is good, but the quality we are providing is not as good as compared to the private system.
Right. And then
Government setup is free.
Government setup is free. Okay. But then when Sahalat program was introduced,
Yeah.
or the health card system was introduced, then what had actually changed from that?
So you receive a card,
Yeah.
and that card has a certain amount of money for
Yeah.
a certain duration.
Okay.
So if you want to get a surgery and you just go to the hospital, you show that card, and all that money will be covered in that card.
Oh, right. Okay. Would you say it does cover most things, or let's say, if someone has a chronic condition like high blood pressure and they would require long-term medication?
Yes, it will be covered in that amount.
You think it would? Okay,
would
so
be
there is
covered
a
in-
decent amount covered
Yes,
in it.
decent amount will be covered in that amount during that duration. And
Right,
mostly,
okay.
yeah, for what I know, it was a quite ransom amount.
Right, okay. Or if someone, let's say, has advanced cancer and they have like one cancer resection and then ongoing radio and chemotherapy, could that be covered? or
So
because that'd be quite expensive
there are
treatment.
centers that actually are affiliated with the government hospitals
Yeah.
that provide the free cancer chemo and radio.
Oh right.
But obviously, there are limitations. For example, medications the hospital won't be able to provide
Yeah.
certain medications that are very
Yeah.
expensive or something. So that would be covered in that health card. Yes.
Right. Okay.
So anything that the person requires
Yeah.
during that duration
Yeah.
would be covered in that health card.
Right.